This is one of those when things go wrong lectures. Intramuscular injections, they're faster than oral, but slower than intravenous infusions through the skin. So why would we do these? Well, what if we need a fast, large dose, such as in a life-threatening situation? Or if our patient has a history of allergies and this drug is irritating, then we don't want to go through the skin. We typically select the large muscle groups, such as the gluteus medius, one of the superior buttocks muscles, the lateral part of the vastus lateralis, and the large deltoid muscle of the shoulder. Facial paralysis can be caused by inflammation of the facial nerve, such as in the case of Bell's palsy, or by heart disease in the case of stroke. Whatever the cause, it's going to affect some of the major muscles, such as the buccinator, which is pressing the cheeks inward, as in when we whistle. The mentalis elevates the lower lip. The zygomaticus, there's a minor and a major. These are the major muscles that retract and elevate the lips, so we smile. The levator labii superioris raises that upper lip, and the depressor anguli oris opens the mouth down and out, somewhat a frowning action there. Strabismus is when both eyes are not properly aligned. It typically is something we're born with. The muscles are not aligned, and the brain often ignores messages from the weakened eye, and so it becomes further weakened. And we call it lazy eye, or sometimes it's called, amblyopia. Anyway, the rectus muscles, which are straight and they're going to pull back, and their action relates to their name. The superior is going to pull the eyeball upwards, the inferior pulls it downwards, and the lateral pulls it side to side. The inferior oblique muscle is going to rotate the eye. Intubation, when we have a situation where the person's unconscious, maybe they're under anesthesia or they've had a traumatic experience, whatever the cause, the muscles that support the tongue, when they become relaxed, then they may block the airway. And that's why the jaw thrust is used in emergency situations, or a oral airway, or sometimes nasal airway, is inserted. Three of the major muscles that affect the tongue, one of them, the styloglossus. Glossus refers to tongue. It's going to elevate the tongue. The hyoglossus is going to depress the tongue, and the genoglossus thrusts that tongue forwards. Inguinal hernia is something that the guys have to worry about because the inguinal canal is large, so that it can handle the spermatic cord and some of the nerves that pass through that canal. And so guys tend to be the ones that have part of their bowel protruding through the tissue there. It's called a herniation. The mesh that is sometimes, there's some debate about this. Some doctors prefer the mesh, some don't. But after the surgery, that area is often sutured up and further herniation is prevented through the insertion of a mesh. If you're wondering what the symptoms of this, guys, often it's a dull, aching pain near the scrotum. Stress incontinence. This is when the levator ani muscles have been damaged. And one of the most common causes is the head of the fetus. It's putting pressure during childbirth, and it may overstretch the muscles. Or an episiotomy, if it's done without finesse, can also result in this. And the episiotomy is done with good intentions, trying to preserve those perineum muscles, because we don't want a rupture during childbirth of that area. Levator ani are actually two muscles, at least two, and their main job is to resist abdominal pressure. So when a person coughs or sometimes while they're jogging, sneezing, anything that's going to create pressure. The pubococcygeus and the iliococcygeus. Now, those are not crazy words because pubo, we think of the pubic bone, which is in the anterior front part of the pelvis. And the ilium, ilio, is part of the pelvis as well, pelvic bones. The bulbosponglosus is the one that constricts the vaginal opening. It does this to prevent urine flow. It also does it during sexual arousal. The coccygeus is a large muscle you can see there in the pelvic floor that is going to help maintain pelvic position and keep that pelvis aligned with the spine properly. If you're wondering what that picture's about, that's a woman doing Kegels. There's various ways to strengthen the muscles of the pelvic floor. Impingement of the shoulder may result in a rotator cuff injury. These tend to happen through repeated over-the-head actions, and that's why some of the weightlifting techniques and stretching and so forth has been modified so that we don't do it that way anymore. Because the supraspinatus tendon, if it's stretched or overstretched and inflamed enough, it starts to degenerate, and sometimes it'll just tear away from the bone. Now, of course, there's surgery for this, but if a person is diligent, they can sometimes prevent surgery through strengthening the shoulder muscles. Supraspinatus. Supra meaning it's above, it's the top part of the scapula. It's going to assist in abducting the arm, so it's going to pull the arm outwards, away from the midline. Infraspinatus, which is the lower part of the scapula, is going to adduct and rotate the arm, so that does the opposite action somewhat. It's going to bring the arm towards the midline. Subscapularis, that one's a tough one to see. This is an anterior view, so we're looking, there's the clavicle. So we're looking straight at the person. They're facing us. And underneath the ribs, then the pectoralis major, you'll see the subscapularis. And it immediately rotates the arm. And that one sometimes becomes inflamed as well. Rhomboids are synergist muscles. They're going to help with the elevation and the rotation of the scapula so that the pressure on these smaller muscles is lessened. Shin splint syndrome often involves inflammation. Now, it can be the periosteum, which is the tissue around the bone that's inflamed, in which case rest is a good solution. But sometimes the anterior muscles of the lower leg are inflamed, and a little strengthening of those muscles may help them counterbalance the action with those antagonistic posterior muscles of the back of the leg. Now think of this, you have the soleus and the huge gastrocnemius. Their action is to plantar flex the foot, whereas the anterior part of the leg, those are dorsiflexion muscles. They're going to bring the toe upwards. The tibialis anterior dorsiflexes the foot at the ankle. The extensor digitorum longus is going to dorsiflex and extend the toes, and the extensor hallucis longus extends the big toes. These are not just crazy words, because tibialis, we think of the tibia bone. Digitorum, we think of digits or toes, and longus meaning it's a long muscle. And extensor hallucis refers to the toe. Back injury, one of the most important health concerns in the workforce are back injuries. More people call in sick because of this than any other. I think except the cold. The cold might be leading. In the case of back muscles, there's various ways it can happen. The lumbar muscles, they're designed for lifting. I mean, not designed for lifting, excuse me. They're designed for posture. And if you look at the diagram upper right, the straight-legged stance is not what we do, because when you bend over, let's say you're tying your shoes and your legs are straight, you're overstretching the erector spinae muscles. And when they're overstretched, they can't contract. And so without that ability to contract, they're very vulnerable. So we always bend the legs to lift. I mentioned the rectus spinae. There's several. There's the spinalis, intercostalis, and they're all parallel along the spinal cord there. If you can see in the upper right. Piriformis, it's interesting. It's a small muscle. It goes from the femur over to the sacrum, but it causes people a lot of grief when it's strained and inflamed. It's going to rotate the thigh at the hip. The iliopsoas, or sometimes is called the psoas muscle, may also become inflamed, and that's the muscle that helps us flex at the trunk. All right, there's a lot more injuries, but this will do for now.